Do you know what an umbilical hernia is? Well, it's a medical condition that occurs when part of the intestine or fatty tissue bulges through an area near the belly button. The result? A soft swelling or bulge that often gets noticed when you're standing, coughing, or straining. Umbilical hernias are a common sight in society, particularly in infants and children. But don't be surprised, adults can get them too. In fact, they are more frequent among women, especially during or after pregnancy, and in individuals who are overweight. Although umbilical hernias might sound a bit intimidating, they usually aren't a cause for alarm. Most of them close on their own by the time a child turns one, and those that persist into adulthood are often harmless. However, complications can occur, making it crucial to recognize and address. Now that we know what an umbilical hernia is, let's delve deeper into its causes. Ever wondered what causes an umbilical hernia? Well, let's dive deep into that. An umbilical hernia is a bulge or pouch that forms in the abdomen. This condition happens when a section of the intestine or a part of the abdominal fat pushes through a weak spot in the abdominal wall, near the belly button. Now, what causes this weakness, and the subsequent pressure that leads to a hernia? There are a few factors to consider. Firstly, increased pressure within the abdomen is a significant cause. This can occur due to a variety of reasons. Heavy lifting, strenuous activity, persistent coughing, or even straining during bowel movements can all lead to increased abdominal pressure. Over time, this pressure can push against the weak spots in the abdominal wall, causing a hernia to form. Now let's talk about pregnancy. Pregnancy, particularly multiple pregnancies, is a common cause of umbilical hernias in women. This is due to the extra pressure and strain on the abdominal wall during pregnancy. As the uterus expands, the pressure on the abdominal wall increases, which can lead to a hernia. Obesity is another significant factor. Excess weight leads to added pressure on the abdomen. This, combined with the weakened abdominal muscles often associated with obesity, makes it a key factor in the development of an umbilical hernia. Other conditions that lead to increased pressure in the abdomen, such as ascites or peritoneal dialysis, can also result in an umbilical hernia. Additionally, it's worth noting that some people might have a congenital weakness in the abdominal wall, making them more susceptible to developing an umbilical hernia. In conclusion, while there are several potential causes of an umbilical hernia, the common thread is increased pressure in the abdomen. This pressure, combined with a weak spot in the abdominal wall, can lead to the development of this condition. Understanding the causes can help in prevention. But how do we identify an umbilical hernia? Let's find out. Spotting an umbilical hernia early can make all the difference. Umbilical hernias can present themselves in various ways, but there are some common symptoms that you should be aware of. The most noticeable sign is a bulge or swelling near the navel area. This bulge may be more evident when you laugh, cough, or strain during activities such as lifting heavy objects. At times, the hernia might even retract or completely disappear when you're relaxing or lying down. Feeling discomfort or mild pain around the belly button is another common symptom. This discomfort might intensify when you're active or exerting physical effort. However, not all umbilical hernias are painful. Some people might not experience any discomfort at all, making it even more crucial to pay attention to any unusual physical changes in the navel area. In some cases, the affected area might become tender and sensitive to touch. You might also notice a change in color around the belly button, turning red or blue. This could indicate that the blood supply to the herniated tissue is being cut off, a condition known as a strangulated hernia. This is a serious condition that requires immediate medical attention. Apart from these physical signs, you might also experience some general symptoms of illness. These could include nausea, vomiting, and in severe cases, fever. These symptoms usually occur if the hernia becomes strangulated and the tissue inside it starts to die due to lack of blood supply. It's important to remember that these symptoms can vary greatly from person to person. What might be a minor discomfort for one could be a major concern for another. Noticing these changes early on can help in seeking timely medical intervention. In infants, the signs can be slightly different. The hernia usually becomes visible when the baby cries, coughs, or strains during a bowel movement. Unlike adults, umbilical hernias in infants often resolve on their own by the time the child is 3 to 4 years old. Recognizing these symptoms allows for prompt medical attention. But what happens after diagnosis? Diagnosed with an umbilical hernia? Don't worry, there are treatment options available. Now, when it comes to treating an umbilical hernia, the options vary based on the severity of your condition, your overall health, and your personal preferences. It's important to remember that no two hernias are the same, so your treatment plan will be tailored to your unique situation. Let's start with the non-surgical options. These are typically reserved for smaller hernias that aren't causing significant discomfort or complications. The primary non-surgical approach is what's known as watchful waiting. Essentially, if your hernia isn't causing you trouble, your doctor may suggest simply monitoring it. This approach is often recommended for infants, as many umbilical hernias close on their own by the time the child turns 1 year old. But what if watchful waiting isn't enough? What if your hernia is causing discomfort, or even worse, complications? In these cases, surgery is often the best option. Umbilical hernia repair surgery is a common procedure. It can be performed in 2 ways: open repair or laparoscopic repair. In an open repair, the surgeon makes a small incision near the hernia. The herniated tissue is pushed back into the abdomen, and the opening in the abdominal wall is stitched closed. If the hernia is large or there's a risk of it recurring, the surgeon may reinforce the area with a synthetic mesh. Laparoscopic repair, on the other hand, involves several smaller incisions. The surgeon uses special tools and a camera to guide the procedure. This method often results in less post-operative discomfort, a shorter hospital stay, and a quicker return to normal activities. However, it may not be suitable for everyone, especially for those with large hernias or previous abdominal surgeries. After surgery, recovery time varies. You might be back to your normal routine within a couple of weeks, or it could take a bit longer. It's crucial to follow your doctor's advice during this period, which might include restrictions on lifting and strenuous activity. And remember, while surgery can fix your hernia, it doesn't prevent new ones from forming. So you'll want to take steps to reduce your risk. This could include maintaining a healthy weight, managing chronic coughs, and avoiding heavy lifting when possible. So there you have it. From watchful waiting to surgical repair, there are several ways to treat an umbilical hernia. Together with your healthcare team, you can decide the best course of action based on your unique circumstances. Choosing the right treatment is crucial. Now, let's quickly recap what we've learned today. Let's summarize the key points we've covered on umbilical hernia. We've learned that an umbilical hernia is a health condition where the belly button pops outwards due to a weakness in the muscles around it. This can happen at any age but is most commonly seen in infants and those over the age of 50. The causes of an umbilical hernia vary. In infants, it's often due to an incomplete closure of the abdominal wall after the umbilical cord is cut. In adults, factors such as obesity, multiple pregnancies, and chronic coughing can increase the risk. The symptoms of an umbilical hernia can be subtle or quite noticeable. They can include a bulge near the belly button that becomes more visible when you laugh, cough, or strain. Pain or discomfort in the area, especially when bending over, coughing, or lifting heavy objects, might also be experienced. However, it's important to note that not all umbilical hernias cause symptoms. When it comes to treatment, options range from watchful waiting to surgery. If the hernia is small and doesn't cause discomfort, doctors may adopt a wait-and-see approach. But for problematic hernias, surgery is often the method of choice. The procedure typically involves pushing the bulge back into place and strengthening the abdominal wall with stitches or a synthetic mesh. But remember, while it's good to be informed, nothing replaces professional medical advice. If you or someone you know is experiencing symptoms that could indicate an umbilical hernia, it's crucial to seek medical attention. A healthcare professional can provide an accurate diagnosis and suggest the most appropriate treatment plan. In conclusion, knowledge is power. By understanding what an umbilical hernia is, its causes, symptoms, and treatment options, you're better equipped to recognize it and seek help when needed. This isn't just about being health savvy, it's about taking control of your well-being. Remember, early detection can make all the difference. Stay informed and stay healthy.